Good morning. My name is Victor Zhao. I am the president of the National Academy of Medicine, or NAM for short. I'm delighted to welcome you all today to the second public session of the Academy's Action Collaborative on Decarbonizing the U.S. health sector. You know, it's part of the NAM's Grand Challenge on human health, climate change, and equity. Just last month, we heard the second installment of the Intergovernmental Panel on Climate Change, known as IPCC report, and evidence continues to show that climate change is a dire threat to human well-being and the health of the planet. This report presented a broad range of climate change effects on human health, including increases in heat-related deaths, infectious disease, and food insecurity, as well as impact on mental health and well-being. Urgent action is needed to address these increasing risks, which should encompass both mitigation and adaptation for a resilient future. We, as the health professionals, should sound the alarm that climate change is a public health crisis. We also know that climate change affects disproportionately poor countries and communities, vulnerable population. So therefore, it's also an equity crisis. What you may not know is that the U.S. health sector is responsible for 8.5% of carbon emission in the United States. And the entire global health sector is responsible for about 5% of global carbon emission. It's a big contributor. So my feeling as a major contributor to climate change, the health sector has a responsibility to do no harm. We must be part of the solution. The Biden administration announced a target for the United States to achieve a 50 to 52% reduction in greenhouse gas pollution by 2030 and net zero emission by no later than 2050. Well, you know what? 2030 just around the corner, and time to act is now. We must activate the entire health sector to decarbonize. So this is what this collaborative is all about. It provides a unique opportunity for people to come together and to do this together. It brings together participants from across the health sector, representing health and hospital systems, clinicians, private payers, pharmaceutical and device companies, health professional, education, academia, nonprofits, and the federal government. And we all come together to align the collective goal and actions for decarbonization based on evidence, shared solutions, and a commitment to improve health equity. As you hear, the collaborative is organized around 4 priority areas with 4 working groups carrying out the work: healthcare supply chain infrastructure, healthcare delivery, health professional education and communication, and last but not the least, policy, finance, and metrics. We launched the initiative last September, and this working group had been really working hard, meeting monthly, to develop their own goals and priorities. And so what are the areas of action? So during this morning's event, you'll hear an update from the co-leads of the working groups on their progress and their anticipated outputs. Very excited. I'm very grateful to them. We also have an update from the federal government, from Admiral Levine and her team, their priorities for action. And we'll have special remarks from Admiral Levine, one of the Action Collaborative's co-chairs. In addition, you also hear remarks from 2 international speakers. Maria Neira, who's the director of the Department of Public Health and Environment at WHO, she'll give you a global perspective of health sector decarbonization and how it's important for achieving global health and equity outcomes. You also hear from Nick Watts, the Chief Sustainability Officer for the UK National Health System, or NHS. And he would share lessons learned from doing what is happening at NHS. So with that setting, I'd like to turn the meeting over to my 3 co-chairs for their remarks: George Barrett, Andrew Whitty, and Admiral Levine. So let me turn over to George Barrett, who's the former chairman and CEO of Cardinal Health. Over to you, George.
Thank you, Victor. Good morning, everyone, and good afternoon to our guests joining us from abroad. We've got a full agenda, so I'll try to keep my comments brief, but I'd like to first thank Dr. Zhao and his team for leading this effort and for keeping us on course. I'd also like to thank all of the leaders who are participating in this collaborative and have really fully committed to this initiative. With each meeting of our working groups, it becomes increasingly clear to me how important it is that we've brought together leaders from both the public and the private sector. Further, as we tackle this critical challenge across a highly integrated healthcare system, the ability to work across sector boundaries will become increasingly important. And the teams involved are already showing that spirit and that capacity. Finally, while our work here is focused on the U.S. healthcare system, events of this past month remind us that our work is affected by and influenced by events in the world around us. And two very recent examples, one on the global stage and one right here at home. The tragic events in Ukraine have taken a horrifying human toll, but have also affected global access to and cost of energy. And while this may shift short-term strategies around fossil fuels, it should amplify our conviction that we must chart a course to reduce this dependence. Second, just in this past week, the Securities and Exchange Commission here in the US issued their proposed rules regarding the obligations of companies to disclose risks associated with climate change, including specific metrics related to emissions, governance expectations, and more. While this is still in the request for comment stage, it is clear that the pressure on the private sector to address climate change will continue to grow. And it's in this context that we will continue our very important work, which Victor outlined. And with that, I'd like to introduce one of our other co-chairs, Andrew Whitty, Chief Executive Officer of United Health Group. Andrew.
Hey, George, thanks so much. And let me add my warm welcome to everybody who's joined us today for this conversation. Very much appreciate your time and attention. As George and Victor both said, bringing together public and private sector is really the only way we're going to be able to make real progress here in terms of decarbonizing the health sector, which, as you heard from Victor, 8.5% of all carbon emissions comes from our sector. So we have a real urgency to do something here. At United Health Group last year, we were proud to announce that we would strive to achieve that goal of zero carbon by 2035. And we would do that with minimal use of offsets. This has to be an authentic, real elimination of carbon footprint. To do that, it was going to require a tremendous degree of collaboration across the sector, and it's going to need a tremendous amount of help from federal and state authorities and regulators, because decarbonizing actually means modernizing. It means we have to modernize the way we do things, rethink the way we do things to allow us to do them in ultimately a healthier way for the planet and also for all of the people who are currently at risk of climate negative impact. With that, I'm very, very proud to be able to announce or to introduce Admiral Rachel Levine, who's going to address a number of comments around the federal government's action plan to decarbonize the US health sector. As you will all know, Admiral Levine is the 17th Assistant Secretary for Health for the US Department of Health and Human Services, and that follows a very accomplished career as both a physician and a public health official in many different state and now federal positions. So with that, Admiral Levine, I'd love to hand over to you.
Well, thank you so much for that introduction. I would like to thank Dr. Zhao and all of the staff at the National Academy of Medicine, and I'd like to thank my co-chairs as well. And thank you for all coming here today for the Action Collaborative's biannual meeting. You know, this collaborative gives me hope. Watching the collection of organizations that make up the collaborative as it gains momentum gives me hope that we will be successful in protecting people in the nation from the health risks that climate change presents, both by reducing the healthcare sector's emissions and by increasing the resilience of facilities and communities. We know that many of you on the line here today are at the vanguard of pioneering work in this field, and I am deeply grateful for your contributions and your input. As 200 plus medical journals asserted in the fall, climate change represents the greatest global threat to health now and in the coming decades. Report after report confirms this and also makes clear the disproportionate suffering that certain communities long the victims of discrimination and disadvantage, already face as a result. These are the same communities, the same groups that have been most harmed during the pandemic and that traditionally do bear the brunt of environmental injustices. On their behalf, and on behalf of future generations, we have no choice, but we have to act boldly. We have to act boldly, and I know many of you have been demanding that for years now. We must take bold, concrete, historically rapid action to both protect the public from the catastrophic and chronic climate threats and to reduce the health sector's carbon footprint. The healthcare sector can no longer watch and react, responding to crises as they emerge. They must lead and mobilize clinicians, administrators, public health officials, and communities across the country. The price of waiting in terms of human morbidity and mortality and the financial burden on our health systems and communities is too high to delay. In the last 6 months, the United States government and Health and Human Services have started moving from words to action to have a lasting impact on this issue. And what I'm going to do is right now is briefly describe some of our work and our plans, as well as our hopes for collaboration with all of you. A major signal from the Biden administration on the importance of climate change and health equity was the establishment of our new office at the Department of Health and Human Service of Office of Climate Change and Health Equity in August of 2021. We fondly call this office OCHI, and it reports directly to me. It is in my portfolio, and it's an office with a pretty small team right now, but a mighty mission. And I want to recognize our entire office as my unsung heroes. They get the Unsung Heroes Award for what they've begun since that time. This office has 3 main areas of work. The first area aims to build the resilience of communities to the immediate health impacts of climate change. Health impacts such as extreme heat, wildfires and the resulting smoke, as well as flooding, and those communities that face more than their fair share of risk, the health equity component, which is so critical. We are working with Health and Human Service units, such as the Office of the Assistant Secretary for Preparedness and Response, as well as our regional offices to tailor solutions that meet each community's unique needs. The second area of OCHI's work focuses on harnessing long-term recovery and infrastructure initiatives to combine climate action with health equity. We know that the environments where people are born, live, work, play, worship, and age can either contribute to people's health and longevity or contribute to illness and health disparities. Those disparities make people more susceptible to health threats of climate change. So OCHI is working with and assisting other agencies and government departments leading infrastructure projects in optimizing the health benefits of their climate change-related investments. Lastly, OCHI works with our nation's hospitals and health systems, both private and federal, to reduce their greenhouse gas emissions and make them more resilient to the effects of climate change, again, in service of their most vulnerable patients and families. As has been quoted here a number of times, the United States health sector accounts for roughly 8.5% of U.S. carbon emissions, and globally, the health sector accounts for 4.5 to 5% of global carbon emissions. So progress in this area is critically important towards meeting President Biden's goal of economy-wide greenhouse gas reductions by 2030. We like to think of OCHI as the glue that holds all of our climate health work at HHS together and the connector to other departments, federal health systems, and private sector stakeholders. Through our office, we look to enhance existing programs and introduce policy levers that are available across the government to combat climate change. We have already started listening closely to constituent feedback through regional listening sessions and interactions with large associations. Our colleagues within HHS at NIH, ARC, CMS have also issued RFIs to collect rich insight and feedback from individuals in communities about their current challenges, their breakthrough ideas, and policy recommendations with respect to climate change and climate justice. This input is a great help to us and will inform program designs. OCHE has now met with every division, every agency within the Department of Health and Human Services to determine their strategy and how we will jointly begin to address health challenges of climate change together. We have launched the department-wide Climate Change and Health Equity Working Group in February of this year to get into coordinated action on this front. And just about every HHS agency and division and office is identifying programmatic actions to take. And we're very excited to soon begin to share some of these new resources to support communities and providers on Earth Day, just coming up, and shortly thereafter. Our updated HHSY Climate Action Resilience Plan, to be released later this year, will document every agency and division's planned work and contributions in detail. And while we continue to create and enhance programs and resources over the balance of the year, a number of programs are already in motion. For example, LIHEAP, the Low Income Home Energy Assistance Program, housed within the Administration for Children and Families, that division, is making a concerted effort to increase adoption of this benefit to support families to access funding to cover home cooling in advance of the summer season's extreme heat. Of course, we are used to extreme heat in the Southwest, but last year we had extreme heat in Seattle and Portland. And so hopefully we're working on LIHEAP, making support families to access funding to cover home cooling. As Secretary Becerra said when we launched OCHE, every lever available to the government is on the table as we pursue progress on climate change and health equity. And we are going to use our pulpit and clearly signal our intent through our commitments. In November, I had the pleasure of leading OCHE representatives and leading the HHS aspect of the United States delegation to COP26, the United Nations 26th Conference of Parties. And we announced the United States commitments to the COP26 health program to achieve climate resilient, low carbon health systems. And I had the pleasure of meeting Maria Neira at COP26. I'm looking forward to her comments today. We've taken the additional steps of supporting the implementation of a new executive order on federal sustainability. This federal order mandates that all federal facilities, including our federal health systems, at VA and DOD, achieve significant greenhouse gas reductions from energy use, vehicle fleets, and buildings. The goal is achieving net zero emissions, including our supply chains, and we hope that the private sector will mirror this. We are currently orchestrating cooperative activities with the Indian Health Service, the VA, the DOD, military health system, and other federal care providers to accelerate our work in this area. And we intend to make our learning as transparent as possible to help others starting their own efforts in this space. We are also exploring many other policy levels that we have at our disposal, including incentives measurement and reporting on emissions. But our emphasis in the near future is introducing tools, technical assistance, and support. To make fast progress, we have to learn fast together. And we seek to create forums for learning and exchange that support different provider types at different stages in their journey on their work on climate change to serve their communities most in need. We seek to engage private sector leaders, such as you all, in making commitments to planning and action similar to our own so that the nation is as prepared as possible for what's to come, tending to threats to both physical health and mental health, which we know are seriously threatened by climate impacts. Since so much of the healthcare in this country comes from the private sector, we need a broad cross-sector approach. That's why you are here, and why the National Academy of Medicine's Action Collaborative on decarbonizing the United States health sector is so vital to our future. I'd like to thank the leadership of the organizations from across the industry that the collaborative is identifying, and we are identifying priorities related to healthcare delivery, healthcare supply chain and infrastructure, and health professional education, as well as policy, financing, and metrics. The National Academy of Medicine's Action Collaborative brings together really some of the finest minds in the nation, really you all, to tackle this crisis, and creates an open door to input from the field through its fabulous new network organizations. We applaud the bold commitments that many healthcare stakeholders have made, and we hope that others will continue to match. And we encourage everyone to become a network organization member so that we can continue to hear your feedback and learn and share best practices. It's not enough for simply to exhort action and repeat statements about how serious this problem is. Instead, we need to make unprecedented, bold commitments. We need unprecedented boldness that we can demonstrate in several ways through this collaborative. By number one, setting clear, measurable goals for emission reductions together. Two, transparently report the progress of federal and private sector health systems on these goals. Three, energetically share our resources in learning with one another. And four, setting aside the territorialism that can sometimes form between individuals, organizations, and industries. Those silos cannot help us in this regard. We need to work together. On this last point, let me say that of all the great movements I've studied and been a part of, what we have in common is deep generosity and the removal of barriers to unconditional teamwork. We need to work together. Given how much of the health sector emissions are associated with the supply chain, for example, we know that progress on emission reductions will require organizations that might be unfamiliar with one another, perhaps even competitive with one another, to find new ways of cooperating. We're seeing that in this group already, and it is really inspiring. We also need to open doors to new perspective and inputs, especially those of often neglected communities around the country that are too often shut out of the conversation, including indigenous groups, communities of color, and older and disabled populations and communities. Their knowledge, their insight, and their passion is indispensable to what we have to build. In closing, history is going to look back at this critical moment and remember us for the action we take or the actions that we failed to take. So I choose action. Secretary Becerra chooses action. Our administration under President Biden's leadership chooses action. I choose to do all that I can to protect our health and our world's health for myself, my family, my community, and to support our nation and the world. It's no longer a question of thinking about protecting future generations, but protecting people right now. So we eagerly await your involvement, your feedback, and your partnership. We know that you are bursting with ideas of how to make things better. Our inboxes are overflowing with your innovations, but also your worries, your suggestions, and your concerns. So keep them coming and keep sending your input to this group and the organizations that comprise it as well. So thank you in advance for your time and efforts, and watch this space in the coming months for more from our office and from OCHI and our HHS partners. Thank you, and I'll turn things back to Dr. Zhao.
Thank you, Admiral Levine. Inspiring words, and I agree with you. We too choose action. Thank you. Let me turn it over to George Barrett to introduce the next speaker.
Thank you, Victor. It's my honor to introduce Dr. Maria Neira, who, as you just heard from Admiral Levine, is doing such important work as the director of the Department of Environment, Climate Change, and Health for the World Health Organization. Dr. Neira has been directing the Department of Environment, Climate Change, and Health of the World Health Organization in Geneva since September of 2005. Throughout her tenure and up until now, she has led and advised on policy and management in key areas of environmental health. Prior to that, she served as Undersecretary of Health and President of the Spanish Food Safety Agency And from 1991 to 1998, she was the coordinator of the Global Task Force on Cholera Control. And so with that, I'd like to turn the podium over to Dr. Nero.
Thank you. Thank you very much, George. Good morning to you and good afternoon from this part of the world. It's really a pleasure to join forces with you. Thank you very much, the President of the National Academy of Medicine, dear Victor. Thank you all for this participation, and thanks for this opportunity as well to present what's the global picture and to tell you how much we need you. Actually, this opportunity for us is to exchange, to join forces. You will see that the opportunity is such, and the critical and historical times we are living, which I'm sure that we don't even want to describe it, force us to be very even more moving into the action that is needed to solve this climate crisis, which is as well a health crisis, and for which the voice of the medical community, the health community, the health professionals at large is more needed than ever. I think we are the ones that maybe we can put some common sense and wise approach to what is needed, and to do all of that on a very ambitious way and at the speed that we all need to sort this crisis. Let me start with something positive. 7th of April, as you certainly know, is we celebrate every year the World Health Day. Well, this year, WHO has decided to dedicate this World Health Day to the theme, which I'm sure you will all agree with that. This year, the theme will be Our Planet, Our Health. If people around the world is still not convinced of the strong linkages between the health of our planet and the health of our people, we will use that opportunity to again mobilize, raise awareness, and give people the opportunity to say, okay, as an individual, what can I do? Starting at home, recycling, using my bicycle instead of my car, educating my children's different, stop using plastic, moving on a different and energy efficiency at home, and passing the message, using your vote, and creating all the action that is needed. And we all know that we need a lot of action to move and to start to address differently the climate crisis and the health crisis that are together. You all know very well that air pollution is a critical part of that, as we know that if we tackle the causes of air pollution or for climate change, one of the best benefits will come from the reduction of air pollution. WHO has been working on climate change and health and for many years now. We have putting outside all the scientific evidence. We have been helping countries to do more on adaptation and climate resilient healthcare facilities. On mitigation, we have been trying to influence and change and accelerate the transition to healthy sources of energy, to the healthy urban planning, to change and go for more sustainable food systems, recognizing that only these three transitions that are so critical will be very positive to achieve massive health benefits. It will be very positive as well to recover our economy, and we all know that this is very much needed these days. And of course, it will be very much needed as well to address the horrible inequities that we are suffering now, and that if we keep this track, we will be probably even going for more inequities and creating even more, leaving even more poor people behind after this crisis. We need to recover from the COVID-19 on a very healthy and green and fair way, and I really hope that we will be moving on that. That is why when we went to COP26, and I was very pleased to meet there Admiral Levine and hear from her real commitment on decarbonizing the health sector, because this is one of the key elements on a plan for climate change and health, which is leading by example. We are convinced that the health sector needs to be part of that, not only describing what are the risks, not only even interventions on how to tackle the risk, not only giving information on how to influence the different sectors that we need to influence in order to reduce our carbon emissions, but leading by example, making sure that our health systems will be contributing to that as well. They will be reducing their own carbon emissions. This will be very, very rewarding. I'm sure that it will be very challenging as well. You will hear later on from Nick Watts, who NHS in UK will be our champion somehow, will be the ones that we will be watching and criticizing. Nick, with all due respect, you will be our champion. NHS in UK has to be our champion and the one that will be providing a lot of examples and good practices, but as well US. Because after we discussed it with Admiral Levine and her commitment and passion and engagement at the COP26, I'm sure that US will be another champion, sharing with us plenty of experiences and good knowledge and how to do it, and using as well those examples to motivate more action around the world. WHO is planning to do a platform where we can make sure that there will be exchange between the private sector and the public sector. Is clear that the role of the private sector is a very important one here. We will be discussing with them, we will be challenging them as well to go even a little bit further when they are committed to reducing our emissions. As mentioned by, I think it was George, it's true that this is, and Andrew, it's true that this will require modernize our health systems. It will require a different way of using energy, of packaging and the supplies, the procurements, the efficiency in all of our health system. But we are convinced as well that this will give us a lot of rewarding experiences, and the health professionals will be very happy to contribute to that. So just to let you know that this will be a priority at global level, we will be very happy to provide a platform where all of those experiences will be put together and stimulate, and we hope that by counting on your support and your leadership, we will be able to motivate other countries to follow. So thank you very much, George and Andrew, and I hope I was not too much on my time. Thank you.
Perfect. Thank you.
Thank you, Victor.
Maria, thank you so much for that. It was really uplifting, and it's such a pleasure to hear from a colleague from WHO, having spent so much time there in 2020. Love to now move on and introduce our next speaker, Dr. Nick Watts, who is the Chief Sustainability Officer of the NHS, responsible for its commitment to deliver a world-class net zero emission health service. Nick's based in London, and he leads the Greener NHS team across the country, which focuses on improving the health of patients and public through robust and accelerated response to climate change. So with that, Nick, we'd love to hear from you, and I'm delighted to give you the floor. Nick.
Thank you. You can hear me?
Yes.
Yeah, yes.
You can understand my Australian accent? Maybe. Thank you very, very much for having me. Good morning to everyone there. Good afternoon to everyone in this part of the world. It is so exciting to be here. Why is it so exciting to be here? Because the NHS a couple of years ago, October 1st, 2020, we said something big, bold, and a little bit stupid. We said we're going to get to net zero. We're going to tackle climate change head on. We're going to treat the climate crisis as though it is an actual health crisis. And we're going to do that net zero by 2040 for the emissions we control directly, and 2045 for our total global footprint, absolutely everything. I'm excited to be here because as we said that, we have little asterisks. Should always pay attention when people have little asterisks somewhere. I see Maria shaking her head, she's right. The asterisk is the NHS can't do this alone. The NHS is not an island. One healthcare system cannot transition to net zero in isolation. We can only do this if our closest friends in the United States, in Europe, and yes, even in Australia, are on this journey with us. Since that moment, there has been an explosion of interest, of engagement into decarbonizing, into strengthening the resilience of healthcare systems around the world, I feel emboldened to the point where I don't think we need that asterisk anymore, because I know that we will have healthcare systems the whole way across the world, and a meeting like this gives me assurance that the United States will be right there with us, heading towards a new net zero healthcare future. 2040 for the emissions we control directly, 2045. And for the sake of transparency, because you should never let anyone not be transparent when they say this, I mean net zero offsetting only 6% of our direct emissions, offsetting only 8% of our total global emissions. And we have every intention of moving that number down as low as we can possibly go. And I promise you won't hear anyone in the NHS even say the word offset until we are sure that we have done absolutely everything we can and we have reduced our emissions as far as possible. The time for anything other than that was a couple of decades ago. The price of entry into this discussion has risen significantly, an order of magnitude. So let's talk about the more interesting side of this. We can all say ambitious things by 2040. That stuff is easy. Let's talk about the more ambitious side of things. And I'm going to talk about what the NHS has done since making that commitment. It's been about 18 months. So let's focus on the first 12 months of that. And bear in mind that the healthcare system in the United Kingdom, and yes, around the world, has been busy during this time. And yet I think the NHS has something that it should be quite proud of. Number one, we had to get our own governance in order. It's one thing to have a net zero strategy for the country, but the country is a big place. It's the 29th of March. On the 1st of April, you'll see a press release out from us saying that we have just passed an important milestone. 100% of hospitals in the country have their own localized net zero strategies. They have their own localized board level lead saying, yes, I am the person accountable in this hospital for ensuring that my hospital gets to net zero along with the NHS direction. Number two, you will also see every integrated care system, ICS, saying the same thing, their own board level lead and their own net zero strategy. This is a total of 900 healthcare net zero strategies that will be announced. And ICS, for the sake of comparison, is roughly the same. There are 42 of them in the country, roughly the same as an American state in terms of how we think of them. They are pretty independent. They do their own thing. They broadly ignore what the center has to say. They administer healthcare and run their own budgets. And yet on climate change, we can all work together. And there are 42 net zero ICS level strategies. The governance is important, but so too is the capacity. And so we have built up a national team from where we were only 18 months ago when there were 5 people working on this. There are now 157 people working on this with a new net zero nursing team, net zero surgery, net zero ambulance, net zero estates, everyone starting to embed the response to climate change into everything we are doing right the way across the NHS. So you need your governance, you need some capacity, you need analytics. And so we've got to the point now where we don't just have a footprint at the national level, we also have a footprint at the regional level within the country, at the integrated care system level, and hold your breath and count to 10 and then wait 2 weeks. We will have that as well for the trust level, for the hospital level as well, footprints across for every single hospital for them to be able to baseline and measure that progress. Importantly, and Maria is right, we want to be a champion of this, but we also want to be held to account. And when we fail and when we just miss our target, we want to be criticized for that, because we want to take this journey seriously. It is going to be tough. And so all of that information is public, because when we miss a target, and we haven't missed a target yet, but I promise you it will come because this is difficult. When we do, we need a chorus of healthcare professionals in our country and across the world and from the World Health Organization shouting, cheering, come on, you can do better. And so we will make all of that analytics public as best we're able. Governance, capacity, core analytics to measure the footprints across the entire healthcare system. And then you got to start doing some stuff that is actually going to reduce some damn emissions, hey? So let's look first at our estate, at the mobile and the fixed assets that the NHS has. We have an old estate, and so we are investing heavily. In the last 18 months, we've invested £500 million into decarbonizing the NHS estate. We've done this because we know that it pays back dividends like no tomorrow, an average of 3.5 years ROI for the average net zero investment that we have made into the NHS. That's for our old estate. Our new estate, we have a new net zero hospital standard. No longer will the United Kingdom build hospitals not fit for purpose, not fit for the future. Our new net zero hospital standard, again, there is an upfront capital challenge that this places on the system. It increases the cost. Look, I'm revealing some data. It increases the cost roughly about 8 to 15% of what you might expect a new hospital build to be. That pays back for itself 5 times over in the lifetime of the hospital, because these are just good, common sense, energy efficient hospitals that our staff and our patients love. Investing in new zero emission ambulances, new zero emission rapid response vehicles. We have the world's first, we have the world's second zero emission ambulance. We're quite keen to have the world's 3rd, 4th, 5th, 6th, 10th, 50th. This is the new direction of travel. Once we have a little bit more innovation to do, but once we have a final specification, our plan is from 2024 onwards, the NHS will simply stop purchasing diesel ambulances and will start only purchasing zero emission ambulances. The fleet then turns over a couple of years later. So you deal with your infrastructure and you deal with your supply chain. And we have a big important role in our supply chain, but so do our suppliers. 2 things that I want to highlight. Number one, 1st of April 2022, coming up in just 36 hours or so, we are introducing a 10% weighting for net zero into every single thing that the NHS buys, every single tender, 10% weighting. It means that every procurement officer up and down the country has to have a conversation with their supplier about what they are doing to respond to climate change, and it builds into the way that we express our values through our costs. That'll be a nice, easy way into this, but it gets a little bit more serious pretty quickly. We've been clear, within the decade, the NHS will no longer purchase from anyone that does not meet or exceed our ambitions on net zero. We're serious about this. So we've laid out exactly what we mean, because when people use vague language like within the decade, you should always say, yeah, but what's behind that? 1 minute past midnight, 1st of April, 2027. Every single supplier has a qualifying criteria for doing business with the NHS, a qualifying criteria before you even get to tender, before you even get to the competition. You will have to demonstrate that your company is aligned scopes 1, 2, and 3 global emissions in the same direction, the same speed, and the same level of ambition as the NHS. It's a bold thing to say. The response from our 15 biggest suppliers, who make up a decent chunk of our emissions, the emissions roughly the size of the entire country of Belgium, was, that is going to be tough, Nick, but we understand that you are not going to be the only healthcare system asking for this. We understand this is the direction of travel for healthcare around the world, and so we are with you. You deal with your infrastructure, you deal with your supply, and you deal with the clinical side of this as well, because the unfortunate thing about net zero is you don't just get to do 1 or 2 or 3 things, you have to do everything. You have to do your 10 best ideas, and then the next 10, and then the next 10 after that, until you can't think of anything else, and then you need to start innovating. And so to that end, we are investing with our Royal College partners across the Royal Medical Colleges across the country in new net zero commissions, asking what does this net zero strategy mean for surgery? And so the Royal College of Surgeons of England of Edinburgh coming together to look at precisely that question. If I am a surgeon, what does this new net zero strategy mean for the way I'm going to have to change my practice? The same for primary care, the same for nursing and midwifery, across each of the major professions that the NHS engages with, that healthcare engages with. We invest in clinical leadership and fellows. We have a new fellowship scheme. It started last year and we are tripling it in size this year, taking the best and the brightest pharmacists, physiotherapists, nurses, doctors out of clinical medicine for a year to move into national healthcare policy, to take that forward and say, okay, well, this is what this means if I'm a urologist, and this is how I might like to see my national healthcare system support me as I transition to net zero, as my profession transitions to net zero. And then finally, targeting. different, easy, quick wins. We're investing in new incentive schemes to shift our clinicians away from the kinds of particularly polluting medicines, where we know that there is just a common sense, safe alternative that, let's be frank, our patients prefer. We're looking at inhalers, we're looking at analgesia in labor, we're looking at anesthetics, we're looking at modern methods of construction and modern medicine, and aligning that with a lot of the work that we do on net zero. So you do the infrastructure, you do the supply, you do your clinical engagement, and then finally you innovate. All of the things I've talked about just there, new programs that were started up in the last 12 months for the NHS. We've got a few answers, but we don't have all the answers, and we have to be clear about that. We don't have a full, clear view of what net zero for the NHS or for a healthcare system looks like by 2045, but we know that we can figure it out. And so with our friends at the National Institute of Health Research, NIHR, we've announced a new £20 million research fund for our best academics, for our best academic health science centres to start to research into exactly that question. What are the kinds of interventions that the NHS needs to put in place? What are the kinds of interventions we need to see from around the world? What can we steal shamelessly from other healthcare systems around the world? You take that sort of big academic innovation fund and then do a similar thing where we repeat it for small businesses who provide and supply to the NHS, do a similar thing for a nurse or a doctor who just has a good idea and says, hey, if you give me £10,000, I bet you I could scale up something cool within my healthcare system. You do the infrastructure, you do the supply chain, you do the clinical investment, you do the innovation. You get pretty damn close to net zero for a healthcare system the size of the NHS. The one thing that is missing is that you need the international collaboration. And that, to finish where I started, is why I am so excited. The NHS cannot get to net zero alone. It can only do that if the United States is moving, pulling, pushing, shouting, cheering at the same pace as we are. That's why, Maria, we're so excited to be able to work with the WHO to establish that new platform, that new unit dedicated to helping the world move to a low carbon future. It's what you need for this to become not just fun, not just additional, not just possible or positive, but an inevitable direction for the future of healthcare right the way around the world. Thank you very much.
Nick, thank you. I think you can feel confident that we understood you perfectly. This is a great reminder from you and from Maria that we have much to share, much to learn from one another. So thank you again. With that, I think it's time to turn the podium back to Dr. Zhao to lead us to the next section.
Thank you very much, Nick and Maria. You know, I have so many questions I want to ask you. I guess time will not permit us to be able to have a deep discussion. But I'm interested, Nick, in thinking about, so we have a working group, as you hear later, on policy, incentives, and metrics. And I think incentive is a really important word that influences behavior. A lot of what you're doing, NHS, very impressive, is of course a single payer system. And it sounds quite top down, I mean, except for the innovation. How do you incentivize every clinician, everybody to act? So in our case, we have a payment system that's different from yours. So we, of course, are moving into value-based payment. So in other words, you can turn that into incentives for hospitals and systems to meet the decarbonizing goal as a payment incentive as well. So I wonder if Nick or Maria, you can say a word about that before I move to the next program.
Sure, I can talk briefly, and I'm sure Maria has some more creative and exciting answers than mine. Mine are the sort of boring things you might expect. Number one, we put it into the job description of every single healthcare professional in the country. If you're a good healthcare professional, you are tackling climate change, 1.4 million of us. You create that permission structure. You make it clear that this is something that the National Medical Director cares about, yes, but also your chief nurse at your hospital. We make them visible. And we try to unlock that sort of potential from our staff. We incentivize, like I said, those sort of smaller innovation grants for our individual clinicians. This is all about getting that sort of bottom-up approach as well as the top-down. Victor, you're entirely right. What we find, to be honest, is we're playing catch-up most of the time. I find that when I go out and ask and we poll our staff, hey, what do you care about? What do you want to see the NHS do more of? They shout back. 9 out of 10 of them, 91% of our 1.4 million healthcare professionals shout back, I want to work for an organization that is taking this seriously, that is living up to my personal values. Often it is the center, it is the national healthcare, the national part of the NHS that is playing catch up to the excellent work already happening on the ground. Our job is to just provide that enabling capacity, a bit of funding to lubricate, a bit of commission structure to go and take forward some creative, some slightly crazy ideas. Our 1.4 million healthcare professionals will do the rest.
Maria, what are you learning from globally, from internationally, from other countries?
Yeah, first of all, things are changing, and today the health professionals are more and more becoming very much demanding or doing something about climate change. So there is a huge demand now coming. I remember when we started at the beginning in WHO at the World Health Assembly to talk about climate change and health. Yeah, people follow, but it was not with the same engagement. Today, there is hope because we see young professionals, we see even not so young, many of the health professionals are now joining this call for more action. And it really gives me a lot of satisfaction to see that some national academies are now going for their own plan on climate change and health, and even very traditional societies. So this is one of the big motivation. Second, in some experiences we have in Italy, for instance, on huge hospitals, people feel very rewarded. I mean, you need to do first an assessment of the carbon footprint and saying, okay, we will reduce this and that. And then you see if you have to explain it to the whole personnel at the hospital for them to be engaged. But it's very rewarding. Everybody is quite rewarded to see the results. And you will realize that there is some economic cost reduction as well. Maybe not the first year. Nick will know much more than me on that. But there are additional benefits that will generate more motivation. And the third one, I think, is looking at the number of deaths you can prevent. I mean, if you tell people how much this represents in terms of impact on public health and how by reducing emissions, how many lives you could save and how many diseases you could avert. Wow, this is very motivating. But of course, to maintain it for more than 20 years, now we want to reach this zero net. So we will require a very strong motivation and commitment by all and incentives. Over.
Thank you. You know, you're both right. If climate change action is incorporated into the same mission as healthcare, I think everybody would take this on, right? Which is why I think education is also important. So you'll hear that we have an education communication work stream where if you are a medical student, a nurse, whatever, you're studying to care for patients, but if this whole environmental area is part of patient care and good health, then suddenly it becomes in your DNA to do it as well, and not something else is imposed upon you. I think that's exactly what you're both saying. And I totally agree that this has to be part of our mission as well, because it's for better healthcare. So thank you very much, both of you, for a really very stimulating talk. Let me then move on to exactly where we are, which is hearing from the 4 working groups. They will tell you what they've been doing. As you heard, we've been up for 6 months, but following this open meeting, we're going to have a closed meeting where we're going to push for exactly setting goals and actions together. We want to move clearly towards, meeting the goals that we all want to see happen. So with that, let me ask Greg Smith. He chairs or co-leads the healthcare supply chain He's Executive Vice President of Global Operations Supply Chain and Medtronic. And so he has been, and his colleagues, working very much on the issue Nick, you talked about, but this is in fact at their own urgency, which is really exciting. Over to you, Greg.
Dr. Zhao, thank you. And hello, everybody. It's a pleasure to be with you today. You know, it's my privilege to be a co-lead on the supply chain and the infrastructure work stream, obviously with Chip Davis from Healthcare Distribution Alliance and Michelle McMurray-Heath from Biotechnology Innovation Organization. But, you know, we are fortunate to have a very strong and growing group of members organization. And if you look across it, we're very broad. We're also very deep within the verticals across the healthcare industry. So, you know, the representation really is from academia, it's from the federal government, it's from distribution, the hospital systems, also the industry with medtech, with pharmaceuticals, with biotechnology, all the way across the board. So the good news is we've got a very strong end-to-end healthcare knowledge base and approach. What's also was quite interesting was as we started with such diverse points of view. So as we build and we gain our priorities, it's a great opportunity for us to truly understand the overall complex of the industry. If you look at our overall charge, you know, our focus is on ensuring that we are identifying and trying to advance opportunities to reduce carbon footprint, and also across the healthcare supply chain, but also strengthen the resilience. I mean, a lot of the similar lessons that we learned in COVID, and making sure that we're able to continue to drive the reliability of the overall supply chain. You know, we also are focused on promoting and sustainable innovation, but also not just in product and manufacturing processes, but also in packaging and also the distribution of the same. Go to the next page, please. The three areas that we're really primarily focused on, and I'll go into a little bit more detail, is to really help scale resources and to take best practices for supply chain decarbonization and to helpfully drive that exponentially. You know, our intent is to help with journey map development so that others can learn from us and can get a very quick approach to how they can actually get started wherever they are on the journey. The second area is really around fostering alignment around metrics and the accounting and the reporting standards. There are a lot of different ways that we look at it across the industry, learn that with our group initially, and trying to help really work with the other three work groups to make sure that we're finalizing and looking at objectives and trying to hone in on those things that are most important. And then we also want to work and try to influence policy and regulatory challenges to make sure that we're helping drive solutions that will actually, you know, help share the learnings in other industries, but also to maybe be able to connect to be able to enablement as we go down this journey. And we hope that we can influence not just the member companies, but actually have a presence and be bold enough to actually influence a much broader group within our segment. Next page, please. So of the three, let me get into just a little bit more detail. I think first and foremost around scaling up the resources and the best practices. We really want through our working teams to be able to help build a roadmap. So depending on where supply chain is or company is in maturity, give us the ability to do a startup or to accelerate their overall journeys by really benefiting from the knowledge base, the experiences that we've been able to collectively report against, and to be able to document, to build that journey map. We also envision that we'll have basically milestones along the way and a journey map that will help each company move through their work stream. Again, regardless of where they are, what size they are, or really where they fall within the overall medical industry. We also want to make sure that we're linking tools and we're having, you know, abilities for them to be able to be very sufficient off the material and the information that we're able to compile so that they can really, again, move whether they're in starting position or whether they're actually in maturity. And we want to make sure that we are promoting very aggressively and really using the voice that we have to get publicity and to get people attracted to the benefits that this will bring. The second area is really around metrics and accounting and reporting standards. And it's aiming to get as many entities as we can focused on actual reporting and moving toward where we're measuring and we're reporting on greenhouse gas emissions, whether that's scope 1, 2, or 3, and also setting science-based targets. You know, the idea to get more common in what we do and to hone in on our choices. There are a lot of things to be recorded out there, but we want to make sure that we are really focusing in and giving some clear direction around the things that we believe to have the most meaningful impact. We also want to make sure that we have in there timelines, and we want to make sure that we are coming together on key dates, you know, and making sure that we're moving toward the same future state. And then we want to really be in a position where we drive bold public declarations. We want to make sure that we're actually having people sign in writing and really envision that we can actually give them bold declarations that hold them accountable more in the public eye, and make sure that we are outlining those shared principles and expectations. And then lastly is really in the area, next page please, is really around the policy and regulatory challenges and solutions. We want to really try to help enhance the alignment and coordination between the industry and between policy and regulatory bodies to help incentivize, motivate, enable, to really get us go after and achieve these sustainable healthcare services, products, and innovation. And we envision doing this by also looking at case studies out of other industries, building case studies from our industry, and really being in a position where we can really help draw relevance to the entire supply chain and show examples of where we can have public and private partnership. And then, you know, as we think about these initial topics, you know, it's making sure that we have regulatory approval pathway and make it clear and help influence to the degree that we can to make it easier for sustainable product improvement and innovation. And then, you know, really think about the investments, the programs, the infrastructure that's needed to be able to truly enable us to be able to achieve these aspirations. So, you know, we are very excited about the work so far. We've got a lot of work ahead of us. We are happy with our group growth and the interest that we've had, and we are also very excited about influencing others across the networks, not just within our work groups, to be able to have a bigger influence on the overall industry. So, Dr. Zell, that is the work we have ahead of us and underway.
Greg, that's truly impressive. You know, I learned something in my journey in life as leader. People support what they build. And that's what you're doing. You're getting the players all working together towards the same goal. And, you know, from creating a roadmap repository to having measurement milestones to influencing also policy, I think all that will align for success. And so I think it's just wonderful as I'm hearing this, how this collaborates bringing together the private sector to work together. And so thank you very much indeed.
Thank you.
Let me next turn over to Michelle Hood. Michelle is the Executive Vice President and Chief Operating Officer of American Hospital Association, and she's the co-lead of Healthcare Delivery Working Group. So we're going from supply to healthcare delivery itself. Michelle.
Thank you, Dr. Zhao, and good day, everyone. I'm here representing our Healthcare Delivery Working Group, and on behalf of my co-leads, Andrea Garcia from the AMA and David Grossman from Kaiser Permanente. I want to start by just thanking the National Academy for this effort and to express that, like the enthusiasm we've heard from our guest speakers today, I think as our work group tackles the details of moving this initiative ahead, I can assure you that there's a tremendous amount of enthusiasm for that work. Our working group has been meeting quite regularly, and I can tell you that the attendance has been exemplary. We have a good cross-discipline approach to the work. And as I was listening to Greg discuss the supply chain, I was struck by many of the overlapping kinds of initiatives that each of the work groups has been taking on. I think that really enriches the overall product and creates a lot of synergy for our initiative. So on our working group, we likewise, to Greg, have many disciplines that are represented. We have very lively dialogue not always agreement, but that's fine. We are open to that and really encourage that kind of cross-fertilization of ideas. Next slide, please. So our working group charge is really to scale sustainable, quality, and equitable healthcare operations and practices. And I will point out the word scale. Greg used it as well. There are initiatives and activities ongoing within healthcare and hospitals and healthcare systems across the country relative to environmental sustainability and stewardship. And we have a lot of ideas as to how we can accelerate that and build upon the good work that's already being done. I do point out the final phrase of the charge statement around the fact that it's not just scope 1, 2, and 3 activity that we think can contribute to our overall goal, but also the idea of building upon the intersection between environmental stewardship and variation in clinical care. So we've been talking within hospitals and health systems for over a decade, probably closer to 2, about the necessity of driving out variation and standardizing around evidence-based best practices. We think that that kind of effort and activity will also contribute to the issues of decarbonization, and we want to pull that into our work as we move forward, recognizing that it will be, as others have said before today, an iterative process. We need to lay the foundation, but we don't want to ignore the expertise we have on our working group to address that issue around evidence-based clinical best practices and reducing variation. The 4 areas of focus you see on the slide before you, I'm going to go into a little bit more detail on each of those. And if we'll go to the next slide, I'll start with the multifaceted case for decarbonization. We recognize that when we say a business case, that sometimes makes individuals have a reaction that we won't be able to accomplish our work unless we can prove a positive ROI. We broadened our thinking around the issues of the case for decarbonization. So we think about it from, as the previous slide said, a multifaceted approach. Yes, we do believe that in many situations, efforts around environmental stewardship do have a positive impact on the financial balance sheet and income statement of an organization in many ways. But we also recognize that there are cases around community health that need to be qualitatively and quantitatively included in our building out of the case. There are also issues around patient safety and quality of care that should be included in that explanation of why it is that this work is so important. So pulling it into triple or quadruple aim of healthcare in the United States and making it part of the bigger work that is before our hospitals and health systems will help to prove the concept for moving ahead. And I love the earlier discussion about you build the infrastructure and you step through a process and you weave in innovation around that. I think that is extremely important as we build out this case as well. Next slide, please. So the sustainability metrics, and we're going to hear more about metrics from Don Berwick later in today's presentation, but our group has also been addressing that. We're using the idea of taking advantage of what's already been done. So a lot of our early work in the work group was gathering examples of proven concepts that have been well researched and reported, so that we're not starting with a blank piece of paper. We've got a small breakout group that is in the process of taking that work a little bit further at this point, and again, weaving it back into the policy and metrics work group. Plan to communicate and promote adoption of metrics is just as important. So once we agree what those metrics are, how do we build out the communication plan and address the right audiences at the right time? So using multiple channels will be important. Networking through trusted sources of information within our field will be a significant effort as well. Next slide, please. Like the supply chain group, we also are looking at policy and regulatory barriers. We often have in different geographic areas of the country, different state regulations that oftentimes conflict with federal regulations. So we want to clean that up to the degree that we can, identify opportunities to remove some of the questions that are in the field about how regulations do or don't support the environmental sustainability goals that we have. So to this end, we will develop an action plan to advocate for the adoption of solutions to address what we identify as barriers or confusion in existing regulation. And next slide, please. The final area that we will look at is decarbonization best practices. I mentioned in my opening statement that there are some really exemplary efforts in the field already. So taking those best cases, best practices, building out playbooks and resources for those who might be in a different place on their journey through this process. We want to leverage the existing frameworks and success stories and do that in multiple ways. We have a lot of opportunity to get in front of hospital and health system executives, state hospital associations, and so forth. And as the last point on this slide says, in addition to the C-suite, we know that oftentimes, as one of our earlier speakers said, frontline employees can be the biggest cheerleaders for this effort, can be the best source of ideas and innovation. We have a lot of work going on within several of our disciplines already, from facilities engineering to environmental services, to materials management and supply chain management. And then linking it back to our health equity work will be really, really important. So with that, Dr. Zhao, I will turn it back to you.
Well, thank you. Another superb set of actions, Michelle, co-led by you. Very, very appreciative. I think that it's quite amazing that the first group and second group, many of your actions and directions are fully aligned. Again, it goes to show what I was saying, that as we're building this, I think we all see the need for regulatory and policy alignment, if not incentive. We see the playbooks and best practices needed. And of course, we really all want to make sure that we are collectively measuring how we're doing and how to do it. So thank you very much for your leadership for this and also at the AHA. So the next one is my good friend, David Scotton, who's leading the Health Profession Education Communication Group. As all of you know, he's the president and CEO of the AAMC, the Association of American Medical Colleges. David, over to you.
Thanks so much, Victor. And Victor, congratulations and thank you for moving this whole thing forward. You're our leader as always, and it's very important. And I also want to thank Drs. Nera and Watts for these very inspiring presentations and all the work that you're doing. Well, the working group co-leads, from whom I'm really learning a lot, are Ari Bernstein from Harvard and Beverly Malone from the National League for Nursing. And like the other speakers, our working group, thanks to the NAM leadership and staff, is broad and includes those from academia, federal government, health professional students, health professional associations, and hospital systems, and also nonprofits. We can go to the next slide, please. Great. So the strategic framework, the purpose of this particular working group is to empower both health workers and learners to better advocate for decarbonizing healthcare through education and through communication that emphasize both the health and the equity benefits of climate actions. And the theory of change that we've evolved is that a health workforce knowledgeable about the health and health equity and decarbonization benefits of climate actions will be more effective advocates for climate actions in their own lives, in their institutions, and communities. And our voices, we believe, can accelerate healthcare sector decarbonization, and through our leadership, drive decarbonization beyond our sector. The primary audiences are several. First of all, health profession students, nursing, pharmacy, medicine, social work, dentistry, and others. Secondly, those who are active current health workers, nurses, physicians, pharmacists, social workers, dentists, and others. Then public health learners and practitioners, and very important to focus on the linkage between public health and healthcare. Health worker educators, hospital and clinic leadership, as you've heard so eloquently just now, and hospital and clinic boards of directors. We believe if at the very top of the organizations, there's not a strong belief and determination to do something, that we will go slower than we need to go. Next slide, please. So the goals and priorities are, number one, to identify knowledge gaps on climate and health, and they are large. Garner support for decarbonizing healthcare as well as greater climate and health education. Thirdly, to scale existing climate and health educational and health worker focused communications programs. And then fourth, to identify opportunities to expand curricula and other educational opportunities across the continuum, that is undergraduate medical education, graduate medical education, and then where we spend most of our careers in continuing education, as well as the local health benefits of climate actions. Next slide, please. We're going to accomplish these goals to begin by having two listening sessions, two groupings, and the first one is going to be a community listening session. The working group will convene 5 to 7 closed listening sessions with representatives of communities who themselves have lived experience, health workers and health learners. And they're going to be close so that people feel comfortable sharing their information. And the potential participants are communities, as has been mentioned by the Admiral, impacted by climate change, patients, youth leaders and organizations, health professional students themselves, and of course, health professional educators. We plan to develop an open questionnaire accompanying each listening session to reach those beyond the session participants and capture more stakeholders' thoughts and comments. And finally, we envision for this first set of community listening sessions, we envision that key takeaways and highlights from these sessions will be shared with and inform the next convening, the next slide, and that's institutional leadership. My last slide, please. And then we will convene institutional leadership once having had the input from those living the experiences. The working group aims to convene institutional leadership to identify knowledge gaps on climate and health, to strongly garner support for decarbonizing healthcare and advocate strongly for greater climate and health education. And we envision that the convening output of this convening could include a discussion paper that identifies the knowledge and action gaps that need to be filled. And as was mentioned earlier, a discussion paper by itself is not enough. It's just a small beginning. And then perhaps an essentials document that lays out specific competencies for each level of education throughout the continuum that would include theory and skills and knowledge that need to be taught. And we also will explore, depending on how things go in the first two convenings, a second convening that would bring together meeting participants with those willing to come from the listening session, community listening session participants. So Victor, that's where we are so far. We're very enthusiastic and even more enthusiastic after today's session. Back to you.
Thank you, David, for your enthusiasm and your leadership. I mean, look, we said this earlier, until everybody in healthcare and health professions see this as part of their duty, through education, understanding what it means, and that this is part of health, better health and healthcare, it's not going to happen. So it's a fundamental cultural issue, which you are leading. And I think that's fundamentally really important. So the last one actually is, again, an area that we talked a lot about, policy financing and metrics. This is led by Don Berwick, who's the President Emeritus and Senior Fellow of the IHI, Institute for Healthcare Improvement. And Don, thank you very much for your leadership and your insight. Over to you.
Well, thank you, Victor, and your co-chairs. This is such an important endeavor. I really, like Admiral Levine said, this really gives me hope. I bring you greetings from my co-chairs of the Policy, Finance, and Metrics Group, John Perlin, currently head of the Joint Commission, and Liz Fowler, who's head CMMI in HHS. We are a little different from the other working groups, both in our organization and tempo. We have meetings every 3 months instead of every month. That's because our working group membership is a cross-section of the members of the other working groups. So we see ourselves as a coordinative and integrative assistant to the processes that are underway. As you've heard from my colleague, co-chairs of co-leads of other working parties, they're deeply into some of the same issues we are, and we hope we can engage in a really coordinative function. The way we've organized our work is according to the three nouns in our title: policy, finance, and metrics. We began with metrics. We have the theory that working ahead on the development of better metrics would be a real accelerator to improvement of the work of the entire collaborative. I think if I could have the next slide, Liz. The areas of focus that we've chosen that you see here: metrics, policy, and finance. The next slide. Metrics are key. If we can come up with ways to assess both the progress of the Action Collaborative and the individual healthcare organizations and other stakeholders that will be part of the collaborative, we think it'll be a real accelerator. So our main focus has been to identify a target set of metrics that will guide the work and progress of the collaborative as a whole, subject to the judgment of the steering committee and the individual members. We want to try to test and scale these metrics across sectors and not come up necessarily with single instructions to the members as to how to measure progress, but plausible candidate metrics. We did a survey of the collaborative about their beliefs about what it is most important to metricize early, and the two leading candidates were first a set of decarbonization metrics and indicators for healthcare organizations focusing on Scope 1 and Scope 2, and at an equal rating metric measurement that would include Scope 3. Now, you heard from the other working groups that they all also are working on metrics. What we're going to try to do is float a series of candidate metrics that then can be moved into a pilot phase as soon as possible. There actually has been a lot of development of metrics among many stakeholders in this field over the recent years, not least of which is Nick and his colleagues in the UK. And so what we hope to put out is a set of metrics that honor the priorities set in our survey, in which members of the Learning Collaborative will move very, very quickly to testing metrics. Next slide, please. The second area of work is now underway also, and that is to collect, largely from the other working groups, candidate ideas for changes in policy and regulation that would both remove barriers to decarbonization and would be proactive supports to decarbonization that would be innovative about the policy world. As you've heard again from my colleague co-leads, the other working parties are also working to identify metrics, to identify policies and regulatory barriers, and we will try to pull these together into a cohesive agenda. We've talked with Admiral Levine and her office, and the HHS seems very open to collaborative help from this collaborative to identify metrics that identify policy changes that would be supportive. We will be focusing largely at the federal level, but importantly, we now know that there are issues around policy and regulation at both the state and municipal level, and including even rules within organizations that could be inhibitory to decarbonization, and that there could be ideas for accelerating decarbonization. So we hope to come up reasonably soon with a candidate list of changes and ideas for policy and regulatory change. The next slide, please. On the finance area, we want to try to understand much more deeply and accurately the financial costs and savings from decarbonizing, particularly for healthcare organizations. There's anecdotal evidence, to say the least, that working on decarbonization could actually be a cost reducer for healthcare organizations. We have specific cases of that already evident. We want to be very disciplined about a look at what are the financial costs and savings, and my co-lead, John Perlin, is taking oversight of this particular part of the project. In all cases, this and the others, we will be collaborating with the other working groups to assemble resources that would be relevant to the decision-making that has to occur among C-suite leaders and boards. Again, like the other working groups, we're interested in collecting technical assistance and resource compendia that will be useful. And the challenge for us will be to coordinate across the 4 working groups so that we're coming up with a consistent set of resources to offer the field as a whole. I think that's the last slide, Liz. We're very excited by this work. We are delighted to have the chance to think about this. And I must say that the members of the working group are as committed as I've ever seen any group. We really can't hold them back. And I'm delighted to be able to help lead them. And Victor, thank you so much for your encouragement and leadership.
Thank you for your great work. And I think, as we said very start, I think all issues converge, and very much the one that you're doing in terms of what to measure, how to measure it, what to do, how to address policy and regulation, and then finally looking at the fundamental understanding of the financial case is so important. So as you all heard, there are several key themes across the Action Collaborative, all the working groups. I don't need to mention them again. I think the unique model of what we have together is in fact exactly this, working across the sectors, public-private partnership, to all collectively work towards this goal. And I think that's the strength of this collaborative. So I thank everyone and their leadership for participating. And I know this has been an open meeting, so you know where we are. We're working very hard. I think next time we're going to meet again, you'll hear tremendous progress. Today, we're going to have a closed session that will continue to build on these shared goals and targets and begin to move towards a lot of agreement and actions. So thank you very much for everyone for joining the second public session. And I will just ask maybe George to close the meeting, and we are ready to go.
Well, that's an easy assignment. Thanks to all of you for your time. A particular thanks to our guests, Maria and Nick. Just added a tremendous amount to this, and to everyone participating. And with that, I will wish everybody a good day, and we'll see you soon.
Thank you.
Thank you. Bye-bye. Thank you.